My name's Carmit McMullen. I'm a medical anthropologist and I study cancer and health services here at the Kaiser Permanente Center for Health Research. A medical anthropologist studies the origins of human disease and how culture and biology work together to shape health and disease across the world and over time. Unlike most health researchers who rely on numbers to do their science, medical anthropologists also rely on stories and things that people say. So we interview people, we observe what they do, and that really helps us personalize what we know about why people might pick a certain treatment over another treatment, how people understand the disease that they have and what impact it has on their life. My mom is from Israel, my dad is from America. I grew up moving between America and Israel, and no matter where we lived, one of my parents was always an immigrant. And so I think I just grew up naturally being that translator and bridging the cultural gap no matter where we were. When I took my first anthropology class, I was just hooked because that's what anthropology is all about. So what got me interested in doing health research as a career really started when I went to Nepal as an undergraduate. When I was in college, in my junior year, I spent a semester in Nepal, and I lived with a family about an hour walk outside of Kathmandu. We didn't have electricity. We didn't have a bathroom, and life was really basic. And I just got to see what it was like for people who live in many parts of the world, how hard it is for them to access health care. Our school had a clinic that treated people up from the mountains who would walk, days to come down to the clinic and stay there during the time that they were getting treated. And it just really spoke to me as something to do for a living. When I went to graduate school, I thought I was going to do international health work, something like working for UNICEF or maybe teaching international development. And I spent a couple summers doing field work abroad, studying tuberculosis and HIV in Nepal and in Uganda. And along the way in graduate school, I married my husband and had a child and realized that living in Nepal or in the Himalayas was probably going to be a hard road to take. And so I ended up doing some work domestically that led to me being hired at the Center for Health Research. I get called in to work on a lot of different kinds of research projects here at the center, but one of the things that really I love to do is work on projects that I lead. And so the projects that I lead are mostly in the area of cancer survivorship, looking at how people with colon and bladder cancers choose different kinds of surgical treatments and what life is like for them afterwards. One thing that people might be surprised to know about me is I go crazy about birthday cakes. Every year for each of my 3 children's birthdays, I make them a cake that shows something that they're doing in their life, something that's important to them at that time in their life. And so over the years, we've had a lot of fun with that tradition. My kids really look forward to it.